Hello everyone. Today I wanted to make a video about something called keratoconus, which is another disease that I suffer from. I suffer from multiple conditions. This one, not as scary since it's not obviously systemic. However, it can be the result of my other systemic issues such as hormonal things. It can also be genetic. For me, I know it is partially genetic. It's probably both genetic and hormonal for me. So basically, what is keratoconus? It's a degenerative, that word is what scared me the most, a degenerative, progressive eye disease that can sometimes even lead to blindness, where your eye prescriptions keep changing. Your left eye, your right eye, they'll switch up sometimes. And it's pretty much astigmatisms that get worse in both eyes. It's pretty frightening. I have so many other issues that I just didn't need another one. So I did a lot of research. As always, I found an amazing surgeon, not in this country, because in this country, initially they gave me a hard time for needing to get cross-linking done, cross-linking I didn't even explain. It's the only procedure that is about 95% effective with stopping the degeneration of your corneas. And it's pretty much where they put in vitamin B drops and then expose your eye to UV light, and it strengthens your cornea. It's kind of like, it's like stiffening. It stiffens your cornea. However, it doesn't improve. There's no guarantee that your eyesight will improve. And I think the percentage of those that improve is like, I don't remember, 40 to 60%. So it's not even, it's an okay number. So there's no guarantee. There's different ways of getting cross-linking done. You can leave the epithelium, which is the outermost layer of your eye, of your cornea and your eye. You can leave that on and then get the vitamin B and the UV light. However, there isn't enough research on it yet, on its effectiveness. Or you could take the epithelium off, which is what I had done on my right eye. I think it was 3 weeks ago. Let me double check. While I'm going back into those dates, I do want to say, yeah, it was almost 3 weeks ago. Tomorrow will be the third week. And it took about this long to get my vision back. The pain, everyone complained about the pain. I have a high pain tolerance. However, I would say the first day or two was pretty painful even for me, because your corneas contain the most nerve endings, like many, many, many nerve endings. So you feel it. I actually came down with a fever, a mild fever, but I had a fever the first day. I just felt terrible all around. Not even just my eye was throbbing, but everything was just, I just felt, generally unwell. And I had that fever and my eye was throbbing, and it was not fun. And then I couldn't see out of my eye until this week. I wasn't able to see. Like, my vision was worse than before my cross-linking. However, I also had PRK done, a little bit of PRK, which is photorefractive keratotomy, which pretty much requires your epithelium to be off anyway, so that's why it's better for keratoconus patients. And our country in America, surgeons don't do that here. There are only like 2 in the US that will do it, and they charge a lot of money for it. And it's the only thing that will correct your vision and maybe possibly break up the cone a little bit, because there's like a cone forming in your cornea over the eye, and that's where all the light enters, and that's your vision's going to get distorted. And so that's the only refractive surgery that is indicated for keratoconus patients. And I really wanted my eyesight back, because my right eye was 20/100, and by the way, it used to be switched. My left eye was probably like, 20/60, 20/80, and then for a while, and then all of a sudden recently, randomly, it switched. My left eye was better and my right eye was 20/100, and I knew something was off, because you're not supposed to, your worst eye isn't supposed to switch into your other eye. Like, that's not normal. But my optometrist, this always happens to me because I always have rare issues, she didn't diagnose it. She didn't even suspect it. and it went undiagnosed until I went to this eye center and got free scans done because I was just curious. And they said, you have keratoconus. And I was like, oh gosh, what's that? At the back of my mind, I was like, it's a possibility that they're just trying to get money out of me because they wanted to charge me $6,000 for epi on cross-linking. Granted, the surgeon I know has a really good reputation. I think her name is Sandy T. Feldman in Sereno Valley, San Diego, and she does have a really good reputation. She says most of her patients, you know, their corneas stabilize and they don't have the issue. But again, there's not enough research to solidify that. I mean, I do believe her when she says that most of her patients haven't had an issue and their keratoconus progressed after the procedure. However, I didn't want to risk it. There wasn't enough research. And I wanted some improvement in my vision because with glasses, the best corrected I could get in my right eye was 20/60, and there was still a pretty bad astigmatism. And when I try wearing lenses, like contact lenses, my eyes get more itchy. And what's contraindicated in keratoconus patients is rubbing your eyes because obviously your right under your eyelid is your cornea, and the more you rub, the more it weakens and deforms and continues to bulge. So we're not allowed to rub our eyes. And when I put contact lenses in, I rub them because they're more irritated, even if they're soft lenses. And they wanted to put me in hard lenses because I can't see anything. So I stopped driving at night. It got really scary. I was like, I can't see. I'm not blind or anything, but 20/100 is pretty bad for me. And again, like I said, I have so many other issues that I wanted to knock one of them out. So I went to Codet Vision in Tijuana after doing a lot of research. And he did PRK and cross-linking on this eye. And I am now week 3. And every day I see clear and clear and clear. And I'm just so grateful because I feel like I got my vision back. And I was starting to see everything double even up close. Like even on my screen. Everything was doubling, tripling, and ghosting. And it's like, it made me dizzy. I would get headaches. It just made my life worse. And I already have, like I said, multiple systemic conditions. So I really wanted to nip this one in the bud. However, I had people telling me multiple things. Like, first of all, they said, don't go to Tijuana. You know, it's Tijuana, it's sketchy. But I mean, honestly, no matter where you are in the world, there are going to be sketchy doctors. There are going to be sketchy places. Just because it's Tijuana doesn't mean that everything there is sketchy. That's not true. I found a renowned ophthalmologist who has a wonderful reputation for a reason and actually studied in California for a little bit at UCSD. And not even that, just from talking to him, getting a feel of him, I felt like he was confident and knowledgeable, and I did a lot of my own research, and I saw that he'd published in like 1 or 2 journals about keratoconus and cross-linking, and it made me more comfortable going with him. In addition to that, he could do the PRK and the cross-linking for a very affordable price. That was like 3 times less than in America. And then by that point in time, when I decided to go with him, my insurance still hadn't approved of the cross-linking here. And I'm a Medi-Cal patient, and they were telling me it wasn't going to get approved. So I was like, screw this runaround. I'm going to take care of myself. So I had a friend drive me to Tijuana, which is only like 25 minutes from where I live, not that bad. And I got the procedure done. It wasn't that bad. It was easy. Honestly, I was under the laser for like a minute. If even, not even a minute. I mean, well, I was probably in the room with the surgeon for like 5 minutes tops because he had to, you know, the nurse was already numbing my eye, and then he had to scrape off the epithelium. He zapped me with the laser, and then I walked into the other room, and they put the vitamin B drops and the UV light, and then I was good to go. And I actually looked pretty bionic afterwards, and I want to show you guys because I thought it looked pretty scary, and I'm definitely posting it for Halloween. So this is me. I don't know if you can see that. So that's obviously the eye that was done, and that's a combination of the vitamin B and the UV light, turning my eye a different shade of color. That's better. And I would just insert it in the video, but this is easier. So, yeah, honestly, a lot of people in the keratoconus group that I'm in, the support group that I'm in online, you know, they complain about their life. And I mean, there's no doubt I'm always going to have keratoconus. There's no guarantee that it'll 100% go away with this procedure. There's a chance, but there's no guarantee. Most likely I'm always going to have a deformed cornea in both eyes. However, I think this significantly improved my vision and may have stabilized it forever. I have to remember to never rub my eyes ever again. So my allergies, I have to put allergy drops in every day for the rest of my life until at least I'm like in my 50s or 60s, because by then the corneas should stabilize. However, what I wanted to say for everyone but those with severe keratoconus, because this eye was actually moderate, not severe, but moderate. Because with severe keratoconus, you need a transplant usually. So I have, you know, I give you my utmost empathy and sympathy for that, because during your time, most likely, or even now, you know, cross-linking didn't exist, or it wasn't studied enough, definitely not in America, and or it wasn't done, and your eyesight just continued to degenerate, and there was nothing they could do, or that's what they said, besides using those really uncomfortable hard lenses. So I have nothing to say about you group of people. However, the ones with mild and moderate keratoconus like me, there is help out there. You don't have to live your life miserable. When there's a will, there's a way. Take it from me. There are doctors out there that are probably in your area, not necessarily maybe in your state, probably most likely in Mexico or Canada, that will fix you. They will fix your eye with PRK. They won't just use the cross-linking, and that can significantly improve your vision and stabilize it. Just remember to never, ever rub your eyes again. I want to say for mild to moderate, I don't think you should wear anything but glasses, because it's usually correctable with glasses, depending on your vision. I don't know. That's a case-by-case thing. But I don't like the idea of putting anything in your eye if you're not allowed to rub your eyes, because then your condition will degenerate. I even asked my surgeon in Tijuana, I said, you know, what happens when I'm done with the surgery? Does that mean, like, if I rub my eyes, it's not going to degenerate? And he said, no, there's no guarantee of that, and you should never rub your eyes again. So I believe him. He's he's right. So don't rub your eyes if you're a mild to moderate KC patient like me. Wear glasses, and I highly recommend PRK cross-linking, because even the last 3 weeks weren't fun. Yeah, I was half blind. 1 month versus the rest of my life, so worth it. Like, I can see now. Like, I still need to get my left eye done because I am not about to have that degenerate. Another thing I wanted to note is that my surgeon, initially, he seemed very conservative, and that's actually the reason why he won me over with the surgery, because he was like, you know, we don't even have to do anything right now. He said he liked to wait and watch before the research came out with cross-linking. He would just have his patients not rub their eyes and then follow up in a couple of months, and he said that most of their vision was stable because they stopped rubbing their eyes. And he firmly believes that not rubbing your eyes will, stop the progression. And I don't doubt that it would help. However, I'm not convinced of that, because I stopped rubbing my eyes back in June or July when I was diagnosed. And my right eye continued to get worse, even just a little bit. It got worse in August, and then it probably stayed with that prescription from August on. And that scared me, because I stopped rubbing my eyes, and I was using allergy antihistamine drops for those couple of months, those 2 to 3 months, and it was still getting worse. And that's why I was like, I'm getting the PRK and CXL. So that's my story. I'm still not going to rub my eyes. But I'm super, super grateful for Dr. Arturo Chayet and his team, Dr. Pincus and just everyone for helping me, and all of my lovely, amazing friends for coming with me to the surgery, driving me back and forth to the border multiple times, because I went for like 2 follow-ups after the surgery because I couldn't drive the last 3 weeks. I have a glimpse. I just had a glimpse in the life of someone who was half blind or blind, and I mean, wow, that's difficult, especially if you're not used to it. Like, you've lived most of your life being able to see, and then all of a sudden you lose that vision. It can be very, very scary. And mine is only mild to moderate. So what does that say? I want to say, always advocate for yourself, because if I didn't, this is yet another condition that wouldn't have been diagnosed. I just have so much body awareness that, like, I advocate for myself, that I feel like I've saved myself from multiple issues because of that. And if I had listened to, loved ones or family members, or even some doctors that are very ignorant, if I listen to them tell me, that you're fine, it's just in your head, I would be worse off. And at the end of the day, you live in your body. No one else does. You live in your body alone without anyone else. So you come first. Your health comes first. Being healthy is the biggest gift. It really is. And I have no regrets. I am so grateful that I even had those funds to spend on this procedure. And I have to get my left eye done. And I'm going to get it done in San Diego. I'm not looking forward to the pain and the blurry vision, but I know it's necessary to stabilize my eye. However, the worst eye is done, and I am very, very pleased. And if you have any questions, don't hesitate to comment or direct message me. I've been there, done that with a lot of medical things, and I think if you do a lot of your research, you go to a center where there's a renowned surgeon or doctor, even look up their license if you feel, apt to do so. If you do your research, if you have the funds, and if you have the will, there is a way to improve your health and your condition. Thanks, you guys. Thanks for listening. I'm so sorry this was such a long video. I hope you are safe and well during these scary COVID times.